Acetaminophen, a crash course for nurses, everything you need to know in 5 minutes. My name is Mike Freilich. I'm a general internist here at Sinai Health. These slides were made to help with some knowledge translation activities for some new medical directives. And one of the medical directives allows nurses on the general medical wards to give acetaminophen. These slides were drafted by Ali Hacker and reviewed and edited thereafter by Tasneem Oadali and Vinci Chan. So let's go through some fact or fiction related to acetaminophen. It is safe to give up to 3,000 milligrams of acetaminophen for nearly all patients. Correct. Acetaminophen should be avoided in adults with cirrhosis. False. It is safe to give acetaminophen to adults with cirrhosis. Acetaminophen should be avoided in pregnancy. False. It is absolutely safe to give in pregnancy. Blood work to assess a patient's liver function should be performed before giving acetaminophen. That's false. Acetaminophen should be avoided immediately before a blood culture is drawn. Also false. And maybe you can guess by the past few fact or fictions what this next one will be. So acetaminophen should be avoided in patients with a fever. Definitely false. So let's walk through a few pearls, a few important teaching points. As you probably already would have guessed, acetaminophen is safe to give to nearly all patients on the general medical wards. This includes patients who have cirrhosis, as well as patients who are pregnant. And the next pearl, you can give acetaminophen even if a patient hasn't had blood work completed yet to assess their liver function. So if there are liver enzymes such as AST or ALT or liver function like bilirubin already available, sure, go ahead and check those results. But these do not need to be given before safely giving acetaminophen. There's a really popular myth that maybe acetaminophen should be avoided. If a patient has a fever, it might mask an infection. This is wrong. Speaking from my own personal experience, when I had COVID-19 and had quite high fevers from that, I felt so much better after giving acetaminophen, after getting acetaminophen, pardon me. So, in case you needed another reason to give it, patients will feel better, especially if they're having bad fevers. And this myth was thoroughly debunked by this randomized trial published in the New England Journal of Medicine. I won't go into the details here, but we'll provide a link below for anyone interested in learning more about that study. Another important pearl, acetaminophen can be safely given before drawing a blood culture. It will not affect the results of a blood culture, so go ahead and give it if your patient has a fever or they're in pain. Another important pearl. So there are some times where you can pause before giving acetaminophen to your patient. So for example, if you notice that they have an AST or ALT above 100 or bilirubin above 50, that would be a very reasonable time to check with the physician before giving it. If you're a physician who's watching these slides, then not to worry. It is still safe to give acetaminophen for patients with these blood results, but it's just the important teaching point since these slides are meant for nurses as part of the new medical directive. So some key points that hopefully you will walk away from after watching these slides. Number one, it is safe to give up to 3,000 milligrams of acetaminophen for nearly all inpatients. Acetaminophen can indeed be given to adults with cirrhosis. It can also be given safely to adults who are pregnant. Blood work to assess liver function is not required before giving acetaminophen. Acetaminophen will not affect a patient's blood culture results, so you don't need to pause and wait until the blood culture is sent before giving it. And it is safe and indeed effective to give to adults with a fever, as well as adults who have pain. I hope you find this helpful and reach out to me if you have any questions, comments, or concerns, and have a great day.